Hi, my name is Dr. Maggie Augustyn, and I am an owner, a dentist, and a provider here at Happy Tooth in Elmhurst. One of the things that has come up and continues to come up as I talk to my patients is this idea that if you have an infection in your mouth and it doesn't hurt you and you don't really have any symptoms, why should you do anything about it, right? It's the idea of, if it ain't broken, because I can't feel that it's broken, don't fix it. And I struggle with how to explain to patients the importance, which of course makes me go back to the idea that our bodies are not always very good at letting us know what's going on. I'm sure you've heard of patients, I'm sure you've heard of colleagues, I'm sure you've maybe even heard, unfortunately, of family members that go for a physical and don't have any symptoms, and they find out that they might have cancer, or are about to have a stroke, or about to have a heart attack based on their calcium test, or maybe even prostate exam based on their blood test. And we have to keep that in perspective, because the mouth is no different. You can be walking around with cracked teeth or broken teeth or abscesses specifically, and you may not have any symptoms. You may not have a strange taste in your mouth. You may not have a toothache, but that doesn't mean that the presence of the disease isn't there. And here's the other thing that I want to tell you. When you have an infection in your mouth, an active infection in your mouth, and you don't do anything about it, one thing that I want you to keep in the back of your mind is this. Your body is continually trying to heal this infection in your mouth. And what it's doing is it's using your immune system, okay, your fighting cells, to heal it. And if you get sick in the future, the immune response that you have for other parts of your body that you may need very desperately is not 100% available to you, because it is constantly fighting this infection. And along the same lines, just because you don't feel the infection doesn't mean that the infection, that the bacteria isn't destroying the bone and surrounding tissues around it. So an infection from one tooth can affect another tooth. An infection of the bone in one tooth can spread out to the other areas, where healing from that might be very difficult down the road. So just because you don't have pain, just because you don't have symptoms, does not mean that your mouth is entirely healthy.